Nice. This machine came with all the backup systems. A solar backup system, aircon, you see it on the wall, and very efficient, very simple to use. This apron the mother is wearing is the protective apron, lead protective apron. It protects the mother from radiation. I am exposing here. The machine is ready.
Here comes the X-ray. Then you can see the X-rays here.
Ready to send the X-ray for Brianna to the doctors. I do a photo shot, send the X-ray to the doctor there. This is the X-ray to the doctor. Very, very excellent and very easy to do. When the patient comes into the X-ray department, we do the registration in the X-ray machine, in the computers. We take the patient into the X-ray room. We do the X-rays. After doing the X-rays, we come back to the computer and send the X-rays to the doctors. That will take only about 3 minutes.
Yeah, about 3 minutes to 5 minutes.
Zvaita hazvinambotora nguva. Isusu inoda kuenda kuna chiremba ndononzwa kuti chii chakaitika paruoko remwana.
In maternity, we use machinery like phototherapy machines. There is a phototherapy machine in use, as we can see in one of our preterm bays. That would never have been possible without having electricity, having a baby with jaundice living and not dying and not being referred to Mpilo Hospital. Odi, mabukabuti. Azabenzu mama, imezi nali yangu ngu Dr. Ngulanti. Tienda kubona mwana oyo uri mukato manti. Bari tu. Wachitungo wani. Ma twins. Twalumba. So here we have Ignet Dube, a mother to twins that were born underweight and preterm. So here we have an example of an intervention that is currently at work. This is a very big intervention for us as being a district hospital, to have a phototherapy machine where mom is going to go back home with her twins alive.
All our gadgets, they use electricity for them to be functional. When there's no electricity at all, it means all these gadgets are non-functional. If that we've got an ICU patient connected to the machine and it's breathing for them, and we don't have a backup for the electricity, it means we are losing the patient. Definitely, that's how important electricity is with our gadgets.
This just goes to show how power can help sustain the life of an individual. I've lived in an era where we didn't have solar power and children have died. It's very unfortunate that in those days our perinatal mortality was high. But now we are geared, we are going to reduce our perinatal mortality because we actually have the things to use now.
Before this water source was installed, we had no water in the maternity wing from the greater part of the day, since we only had council supply for 2 hours. So at times we would be forced to ferry water from the other section of the hospital, which is 2 kilometers away, using the hospital vehicles to bring water to this side so that the toilets, the bathrooms and the labor ward is taken care of.
Water is life, and most importantly to our mothers expecting and those who've just delivered. Because of the availability of water and the solarized boreholes that we have installed at 447 health institutions throughout the country and another 150 that are about to be completed, our maternal mortality cases are few, and health facilities can provide proper maternal care to our mothers who use this water for drinking, for washing, for cooking, and other potable uses.
Now all mothers will come, if you get inside, you realize that it's fully booked because water is available. It's no longer a channel. The patients can wash, we can also cook, and we can also clean. Even the vegetation here, we can also water our flowers to make the place look good.
This incinerator is the largest incinerator that we have in Southern Africa, capable of incinerating 250 kgs per hour. Also in line with the thrust of SDG 11 for sustainable communities and cities. This incinerator produces absolutely zero gaseous waste according to our EMA standards, and is also capable of producing non-hazardous solid waste. So what we are trying to do here is to collect all of the medicinal waste from Bulawayo, Matabeleland North, Matabeleland South, Masvingo provinces, so that there is sustainable incineration of all medicinal waste. It is also a very automated system where there is minimal use of labor, and it is also equipped with an uninterrupted power supply system that is capable of coming in as soon as there is a power outage. We have a similar system that we installed at Salim Gabe Central Hospital, which is responsible for the incineration of medicinal waste in the northern region, that is the Mashonaland provinces and Manicaland province as well.
Site, I showed you a liquid waste collector, isn't it? Now here we've got this one is an impactor. Then we've got the skipper here. So say in Gucheni or UPH wants us to collect their waste, we just send the impactor. So it's part of the program, the project, yes. The medical waste is produced from any medical center. So meaning everywhere, whether it's private or it's government, as long as they produce medical waste, they've got the right to come and incinerate here.
This pharmacy has helped us a lot because before construction of this pharmacy, we didn't really have a pharmacy at this hospital. We used some of the rooms which are vacant to place our medicines there, and our medicines were all over the hospital.
Those rooms were not well equipped. That is to say, they will be absorbing moisture, and also they were on the ground.
But with the construction of this building, all the farmers' commodities are now housed in one place with proper conditions, including air conditioning and stuff, and all the shelves. We no longer have medicines lying around on the floor.
Visitor by Shurugi Clinic, hospital, Pagawagwa pharmacy, new one, inowanikwa mishonga yose. Tinosefiwa mishonga zvakanaka. Mushurugu pachipatara.
This initiative is an integrated approach, a kind of partnership that is trying to address multifaceted bottlenecks at the same time, interwoven bottlenecks, because we realize that the institutions in the health facility can only promote system strengthening when you address these bottlenecks. My joy is that I go to all the provinces, the 10 provinces in this country. And not only that, I go to the 64 districts in this country. I realize that this partnership is touching the life of all the districts in this country. And the beauty of it is that no matter how remote the place is, you go there and see that these communities that never thought they would have borehole in their life are benefiting from the clinic's borehole. The communities that never thought electricity would get to them are having access to electricity through the services provided to the clinic in that place. This is the kind of thing that gives me joy, that makes me to feel quite fulfilled in terms of contributing to what the government of Zimbabwe want to achieve by turning this country into an upper middle income society by 2030.